I'm Christina Ellis. I'm the manager of the Academy at NHSA, and I'll be your host today. And I apologize, I am losing my voice a little bit, so I'm going to try really hard to get through this hour with you all today. But like I said earlier, I'm the manager of the Academy at NHSA, and I have the honor of overseeing the program of excellence here. And I've been with NHSA about a year and a half. And prior to that, I was in a program of excellence actually in Tulsa, Oklahoma called CAP Tulsa, where I worked for 12 years doing various programs from quality assurance to health, food service, collaborative partnerships, and just different collaborative opportunities at that location in Tulsa. So today, I wanted to start off with what we normally do with any NHSA webinar is ground ourselves in our vision and mission here at NHSA. And that's to be the untiring voice that won't be quiet until every child is served with the Head Start model of support for the whole child, the family, and of course the community. And we also want to be that advocate for policy change as well. And then we are compelled to fulfill this mission by the promise of the possible outcomes that we have here to be that untiring voice, the collaborative Head Start field, the nonpartisan support for increased federal commitment to Head Start, and healthier, empowered children and families, and stronger, more vibrant communities. And what better way to showcase that than the program of excellence here at NHSA? So what are we going to be doing today? I'm going to give you an overview of Program of Excellence. We're going to talk a little bit about why you should apply. I had colleagues back in Oklahoma give me a call last year and say, Christina, tell me about why I should apply. What is this all about? We're also going to go into how to apply. Some of you may have already filled out the first application piece of it, because I have been receiving those in the last few weeks. But some of you, maybe you're making the decision based off of the information you're going to hear today. So I want to make sure that you have all the information you need to make a good decision for your agency. The other thing, which is the most exciting, is program highlights. Today, we're going to hear from two programs, and they're going to tell you about their experience last year, because I can sit here and tell you how wonderful this program is, but there's something different about hearing it from Tony and Levon and their experiences, the highs and lows of it, so you can get a really great picture of what Program of Excellence is and if it's for your program. And then we're going to have plenty of time for questions, whether that's questions for myself or Tony and Levon. We're going to make sure that there's an opportunity for you to reach out and ask some questions as well. So let's just dive right into it on what it is. And so what the Program of Excellence does is it defines the mark of quality with a 41-part framework, and we call them the 41 indicators of excellence. You might also hear me refer to them as quality indicators. So we have these 41 indicators that are going to reflect established performance criteria, extract evidence of the ways your program goes beyond the Head Start program performance standards. We know that you know the Head Start program performance standards, but we're wanting to know where is the innovation there and what you're doing above and beyond those performance standards. And then also to describe the best and most effective practices for motivating and helping programs make lasting improvements in their services. After the Program of Excellence awardees receive their award, we work with them throughout the 5 years of their accreditation to really sort of tease out what they're doing, so then we can share that with the rest of the Head Start field. Is what is making them the lighthouse? What is making them the Program of Excellence? What are they doing in their program that we can then share with the rest of the field so that can be replicated across the country? And so what does it do? It recognizes and supports the outstanding performance of Head Start grant recipients across the nation. It's earned by programs that consistently demonstrate excellence in program management and service performance, and continually support the achievement of robust outcomes for children birth to 5. So these are going to, again, be the programs that are consistently demonstrating that excellence. Now, this might be the first time you've ever heard of Program of Excellence before. Whenever I came to NHSA a year and a half ago, and they said, Christina, we'd like to reestablish this quality initiative for NHSA. I said, great, tell me about it. Let's hear from the last 5 awardees. And then I learned all of this fantastic history about the quality initiative here at NHSA. One of it is that it was developed in the early 1990s. So we have some programs that have been a program of excellence since the 90s. It's also grew out of our initiative to improve and highlight program quality. There isn't anything out there that's Head Start specific that says this is what a quality Head Start program looks like. The other thing is it's looking at high quality operations and practices in 10 program areas. And you're going to find that they align very nicely with the focus area 2, which we're going to talk about a little bit more later in the presentation. And then we had at one time 2 levels, a program of achievement and a program of excellence. And then our first programs were awarded in 1995. And I love these old pictures to be able to see how the quality initiative has grown over the last few years. We had a large redesign in 2015 to align to the quality indicators with the Baldrige Performance Excellence criteria, which we still use today. It's a combination of the business and education sector from the excellence criteria. It is research, review, and analysis of quality models, including elected state QRS systems, and feedback obtained from you guys. You tell us what you're looking for, what you consider high quality, and then we're able to incorporate that feedback into our quality indicators based on what is happening in the world at that point in time. And then also we had 13 programs awarded Program of Excellence in 2022. We had 21 applications, and we had 13 who were awarded, and we had 2 that did not receive the accreditation, and we had the rest of them, I believe it was 5, who were not able to finish the process for various reasons. So I like to share that information out with you too. The other thing is those who were not awarded or had to stop the process, they have the option of coming back this year and applying and having a spot for them this year. And so it's right now divided into 3 quality indicator sections. We're going to talk about organization development, engagement, and then program enrichment and innovation. And this right here is a picture of our 41 quality indicators. And if you go here, you'll be able to access them to see all of the indicators, because I know that that is important to know. What are we asking? How long this is going to take? What kind of commitment this is? And so we like to be an open book. I tell people this is an open book application. We even provide the scoring criteria for you so you know what each narrative is going to be scored on. And so here is an example of what a subsection and category looks like within that indicator. So this right here is indicator 1, and it's what we all start with. It's what I started with today's meeting on, is the mission, and how does the mission guide the program's operations. So we give you the question, and then we give you suggested evidence. And so some will not have evidence required. The majority, though, do require evidence that you would attach into your application. So for example, on this one, we suggest the vision statement, the mission statement, and core values. And some of you might be thinking here, well, we don't have core values. And this might be an opportunity for you to think about what you have as far as your mission organization, and maybe core values is something that you want to add or something that you want to think about adding, and you can write that into your narrative as well. But we have found programs where after going through the program of excellence, they've shared back with us that it made them rethink about what they do as leaders and how they support their staff and programs. And some of it they create during the process if there's time for it. The other thing that we do is we give you the scoring criteria. We say exactly what we're going to be scoring this narrative on. And in this case, we say the response provides an in-depth description of how the mission guides the program. And then we put what it should include to have a complete narrative. And then we also give you questions to consider whenever you are writing your narrative to help fill in some of your responses to the quality indicator. And there might be questions in the chat. And just to let you know, whenever I turn it over to Tony and Levon to talk about their experience, I'll be going through the chat along with Courtney, and then there'll be a time at the end for question and answer as well. The other thing is, what does the accreditation mean? So it is a 3-month application process. So you might have be a little confused that earlier I said I've already been receiving applications, and then here I'm talking about a 3-month application process. There is an application to participate, and then from those applications, 25 are chosen to participate, and then they receive the full application, and the full application includes the quality indicators as well as live session meetings. And you're going to showcase your leadership and your effective management, transparent and sound fiscal stewardship, informed, responsible program governance, parts about dealing with all aspects of partnering with parents, highly experienced and educated staff, any sort of innovation as far as programming goes, and quality services that responds to the aspirations and needs of children and families in your program as well. And what you would do is respond to narratives in each of those sections. One thing you'll notice that there isn't a focus on necessarily classroom environment. There are a few questions on curriculum, but we know between class and other things that you're doing, maybe with state licensing, that is taken care of with other initiatives. And then the benefits of participation here is you're going to get a thorough Head Start specific organization evaluation. Again, I want to focus on the words Head Start specific there. We're going to be looking at narrative through a Head Start lens, and we really thought about it when you think about a focus area to visit and what you're preparing and the types of questions that you're going to ask. I think of it as a safe space to prepare for something like a focus area 2, where you're going to get feedback and you're going to have an opportunity to ask questions and to submit narratives to get reviewed, to be able to have feedback. And so we're going to be the safe space for you to practice your focus area 2 with your staff. The other thing is we're going to identify strengths and coaching in areas for continuous improvement. So you're going to receive feedback at the end of your application, of course, where your strengths are, but also where areas we think that there could be some continuous improvement as well. I heard several times last year where they would say, you know, Christina, we hadn't thought about this yet. And my staff, I had a new staff member, and going through this process, she knows more about her job and her role, or things that she didn't really pay attention to at the beginning because maybe she was learning those sort of foundational things, and now she's ready to sort of take the next step and go beyond those foundational expectations. The other thing is the announcement sent to your center's representatives and state governor. And here are some, here is some social media that we have, as well as we have done some blogs from different Program of Excellence awardees where we shared their strengths out with the field to say this is what's going on at Children's First. program, maybe this is something that could be replicated in your community as well. And then also recognition at NHSA's National Head Start Conference and in our publications. Use of the NHSA Program of Excellence Accreditation logo. I like to say on this one, this is where you get all of the swag. And so this is where you get your award or your plaque that can go in your program, as well as other things that you can provide to your staff and community to celebrate the hard work that you have done. And then, of course, entrance into a community of the best and most innovative educational programs across the country. We rely heavily on these Program of Excellence awardees to tell us what we can do better, to work with us to improve on any programming that we have, as well as maybe being speakers in different webinars that we have as well, or instructors in some of our courses, or we're doing a video series here for the Academy, and we pulled on our Program of Excellence awardees to be in the videos to talk a little bit about their programs and about NHSA and the Academy as well. So here is the application overview. So now we're into the how. So we have passed the why, and you're still with me, so that's great. So now let's get into the how. We do have a program profile that you complete, and the program profile is evidence of full compliance with the Head Start program performance standards. And if there was a finding at your last review, you can submit evidence that you have made the corrections or you are on a plan of correction as well. And then evidence of financial integrity. So we do ask for 3 consecutive years of your independent audit reports and your most recent annual report referred to by the Head Start Act. And then a brief written narrative description with information about your families and your community served from your program. And so that's going to be in your program profile. It's the first thing that you submit once you're accepted into the program. And then after that is a demonstration of innovation, and then a demonstration of comprehensive quality. So those 41 indicators, and the innovation is a part of the 41 indicators. I have it broken out here, but innovation is built into all of the indicators. And then our application and review process. So there is 3 months to complete. The application you have access to on February 1st, and you have all the way through April to complete the application. We do provide a suggested timeline to make sure that you are staying on track with each of the narratives that you submit. And then we do have an LMS, or a learning management system, that you would upload these to. We also have 3 online sessions. So once in February, March, and April, and that is to just answer any questions, provide feedback. Maybe our reviewers are there to say, this is what we've been seeing. We want to make sure that everyone is staying on track. There is an application fee as well. The other thing, and I mentioned reviewers, is that we do have professionals with extensive knowledge of and experience in Head Start and Early Head Start reviewing your applications. And then the Program of Excellence is it's designated for 5 years is the term level there. And then you also get program support. Like I said, I am the person here supporting you throughout your journey of the application. One is you'll receive learning management system training, so you know about our system and where you will be uploading it. The other thing is that we provide you a narrative template to make sure that you are completing it in a way that is cohesive and that the reviewers are able to open up and read. And then you're going to have access to the quality indicators outside of the LMS, so you'll have full access to those. There is also an application Q&A document, as well as NHSA staff support. So I'm there the whole way. Sometimes I even review applications before they're finally submitted to the actual reviewers. There's no sort of grading or scoring that I do. I can just sort of give feedback on, it looks like you need to add some more here, or you're missing a narrative piece here as well. And then eligibility, it is only for active and current NHSA members. And like I said before, full compliance with the Head Start program performance standards, that you're not currently subject to competition, and that we have 25 programs annually that can go through our program of excellence application process. So let's hear a little bit from Tony and Lavon, who participated in this process last year. And so I'm going to go ahead and stop share, and we'll let Tony share a little bit about her experience.
Well, hi, everyone. Thank you very much for allowing me to come and talk to you a little bit about our experience here at Mohawk Valley Community Action. Let me just share a little bit about our program. We're located in upstate New York, and we currently serve 850 children in 3 counties in central New York. And I'm the director of the program and have been for about 15 years now. When we heard about the opportunity to apply for the Program of Excellence last winter, it was at a time when our staff were really tired. We were just kind of coming out of the pandemic a little bit. Things were getting a little bit better. We were starting to reopen classrooms and things, but staff had been through a lot, and our children and families. And so I really saw this as an opportunity for us to kind of start to refocus on our bigger plans and remind ourselves of the great work that we do, because I think we kind of felt like we were stuck in the trenches for a little while with the pandemic. We were really excited when we went to the Policy Council and our Board of Directors, and they fully supported us moving forward with this application. And so I did bring it to our leadership team for their input. And I think at first they were a little bit apprehensive. They were tired, and they were like, this is going to be more work. But we talked about where the impact and end result could be. And that's where we kind of kept our focus. And so it was not my application, it was a team approach. And we met as a team from the very beginning and then all the way through until we finally submitted the application in April. I did go to all of our different component coordinators, health services, family services, child services, education, special services. It really did take the full team, because we wanted to and needed all of their input to be able to document and represent the work that we were doing at our agency. One tip I would say is, if you do move forward with the application, I always had everybody send everything to me. I was the person that uploaded. So, identifying one person who will upload all of the information, we wanted to make sure it looked congruent and consistent, and that we followed the same format as we moved through the process. And I do think that was helpful. We were super thrilled in April when we submitted it, and it was like, okay, that was, now it was kind of a waiting game to see if we were successful. And again, in June, when we did learn that we were received the accreditation, it was a huge shot in the arm for everybody. Not only the staff that worked really hard and to put all the materials together, but for the children and families that are coming to our program, for the staff who work here. We did see the Program of Excellence accreditation as a real way for us in times where it's difficult right now with enrollment and also recruitment of staff. We market ourselves now as a program of excellence. Come work for a program of excellence, enroll your child in a program of excellence. And we have seen and feel as though that is something that's definitely helping our agency and our program. So another thing I think just to consider. I do also want to mention that last week our program had our focus area 2. We're the grantee for 2 grants. And so we had both FA2 for both of those grants at the same time. I've been through focus area 2 or reviews before, and I have to say that having gone through the Program of Excellence accreditation really assisted us. Like, we already had all of our documentation for the 41 indicators. We had our supporting evidence that we had already put together, and we had it saved in our public folder, which I would also suggest as you're collecting everything, if you can have one place to keep it all. So then when you need to access it later, it's just very easy to pull that data that you worked so hard to collect. But we did get through our focus area 2. And when I talked to all of the team, they all said the same thing, that they were really, even at the time, it seemed like a lot of work. They're so glad that we did it because it made it much easier to go through the process. And I also want to share that, we wanted to make sure that our direct line staff, who are really the ones who are in the field working with children and families every day, felt like they were a part of this process. And so one of the things what happens when you receive your accreditation is you receive a plaque. And what we did was every 2 weeks, we have 19 sites through three counties. Our plaque gets moved every couple of weeks to a new site, and it's displayed in that center so the families and the children and the staff there can feel a part of it. We have a communications person who goes out and does pictures and blasts our social media and, really puts it out there. And again, I think that it's supporting our recruitment efforts for not only staff, but for children and families as well. So it is a lot of work. I won't deny that. It takes a lot of time to put together something like this. But I will say that Christina and her team, whenever I had a question, I've got timely responses. People were very helpful to make the process as easy as possible. And I would encourage anybody to certainly apply and see where it goes. I think it would be a valuable experience for anybody that's considering applying for this accreditation. So that's all I have, unless anybody has questions or how you want to do that, Christina.
No, so we'll just go straight into Q&A then and ask if there's any questions from the audience for Tony or myself, or anything that you would like more information on. And I think they were in chat, and I don't know if they can unmute themselves, Courtney.
They can now unmute themselves. And if you just
Okay,
raise a
fantastic.
hand, we can call on you. You can ask them in the questions and we'll be.
Yep, it looks like Deidre has a question raised, her hand raised. Go ahead, Deidre.
Hi, Christina. I just, my question is, I want to know, how does this differ from NAEYC accreditation other than it's specific for Head Start? And is there a benefit of this over NAEYC accreditation?
Yeah, I was waiting for someone to ask that question, Deidre. And so what I'm going to share is that there are probably several other types of accreditation, and that I recommend taking a look at both accreditations and seeing what best fits your organization. This one, you're going to find that we are looking at innovation, program management, fiscal stewardship, focusing in on parent relationships and community work. And so that's going to be something where we're going to be focused on, and of course the Head Start specific. But I'm not going to say that I would recommend one over the other than that as an organization to take a look at what both are looking at to see what best fits your organization. Deidre, that probably wasn't the answer you were looking for, but that's what I would recommend is you'll get access after this meeting to the quality indicators, and so you would be able to compare that to the NAEYC program standards to see what best fits your organization.
No, the answer was sufficient. Thank you.
Okay, great. Thank you. And then there were some questions in the chat that I think I got to later on in the presentation as far as the cost, and that it is a 5-year term for being awarded a program of excellence.
So do we pay the $3,500 at the time of the initial application, or once we're selected to proceed?
Once you're selected to proceed. Great question.
Is there an annual, I came in late, I'm sorry. Is there an annual report and annual fee as well for the 5 years?
There is not an annual report or an annual fee. In year 4, there will be conversations about reapplying for a program of excellence and assistance there. But one of the things that we do provide every year is additional sort of collateral and information for your program to continue the celebration for the 5 years and to get your staff ready and pumped for going into that final year and then reapplication. So for example, some of the things that we provide are sticky notes with the quality indicators on there where you can say, you can give it to a member of your staff member saying that you represented quality standard 10 and we're going to celebrate you. Like, we will restock those things and provide other things for you to celebrate throughout the years.
Does the Office of Head Start give any special recognition to the program, or?
No, this is through NHSA. And so we do provide information at our conferences to support and celebrate the programs, as well as there are blog spots and in our publications. And I'm sure that that is also read by the Office of Head Start and whenever they are there to acknowledge them.
When you reapply, do you start the application over from scratch, or do you get the application you already did and can just make updates and things?
You do start from scratch because we consistently update the quality indicators as new standards are set forth, or as the Bold Ridge, as they update their criteria as well. And so by year 5, more than likely there will be either additional indicators, or some of the indicators may have changed the language.
Okay, thank you.
We do recommend, like what Tony said, keeping a file of your documents to make sure that you have them and that they're available, because there might be some where just some tweaks are needed. But more than likely, you won't have the same, information from your annual report. You're going to need all that information updated anyways.
Okay, thank you.
Christina, I'm not sure if you shared how many programs are accredited.
Yeah, so last year, so we, a little sort of history of this is the program went on hiatus for 5 years. So last year was, the year before was the end of our last Program of Excellence awardees before we had made our rebranding and rechanges for this last year. And so there are 13 right now who are accredited with the Program of Excellence. And we had 21 apply last year. 2 did not receive accreditation, and 5 for various reasons had to drop out and weren't able to finish their application.
Okay, so if we do apply and do not receive the accreditations, I mean, is there like a probation period? I mean, you can apply next year. What's the process?
You can apply next year with a slot guaranteed for you the next year.
Got it. Thank you.
Just to clarify, if you are a multi-grant grantee, so for example, we have 9 different grants across different regions in different states, is the application for the organization as a whole, or is this done per grant?
It is done per grant. And I'm sorry, I can't see who's talking. I was going to look. What's your name?
My name is Ashley Patrick. I'm with Save the Children Head Start.
Okay. And Ashley, if you can follow up with me, I want to make sure that I have the right information specific to your program, but it is per grantee. And I'll get you my email at the end here. Okay. And then it looks like we have Sabrina, you've got your hand raised.
Yes, thank you. So I'm on the NHSA website now, and there's a button that says register now. And when you click on that button, it's requesting the 3,500 application fee, and it has a due date of January 6th, which is prior to the 3-month application window. So does that mean that we need to pay the $3,500 prior to the application?
No, there should be, there's a register button for that, but there's also something there at the very first part that is, you're basically requesting information and to be put on the waiting list.
Yeah, so I did that part, but it's the registration part that I think is a little bit confusing, because it's saying that registration is open until Friday, January 6th, which to me indicates that there's a deadline for paying the application fee.
Yeah, we'll follow up, Sabrina, after this. Courtney, can you take that note? And we'll follow up with information on registration to be clear on that. I want to make sure I can take a look at that and make sure we're talking the same language there so we can get that corrected, Sabrina.
Okay.
Hi, Sabrina.
Hi, Maria. How are you?
Good. Miss you.
All right, and then it looks like Jessica, you've got your hand raised as well.
Yes, okay. So you said per grantee, and then you also said per grant. We are also in that same situation where we're one agency, but we have 4 different grants.
Yeah,
So
I'm gonna follow up and send something out to everyone
okay,
with the exact information. I don't want to say the wrong language here that we're using because I don't want to confuse myself here. So we're going to follow up with that and send that out. But the one thing that we don't need is if there are, I'll use CAP Tulsa, for example, in Tulsa, Oklahoma, the program that I'm from, is CAP Tulsa would apply, not the 9 locations in Tulsa. So there wouldn't be a Frost Program of Excellence or a, another named center. So it's not by center, it's by, and we'll get that information out to you. And then Kelvin, did you have it or did you take your hand down?
That was my same question. We are one
Okay.
organization and we operate in multiple states, but we have 4 grants as well, but they're all under Enrichment Services Program.
Okay, yeah, and so we'll get that information so that way it'll be crystal clear and that I don't confuse you or myself on what we're trying to share here. But I do know that you don't need to do it by center if you have multiple centers, but we'll figure out by grants, okay? And then Deidre, hi, you had your hand raised.
Yes, I have a couple of more questions. One regarding the application. So prior to this webinar, I was trying to complete the application, but my agency's name did not populate in the search bar for the agency. So does that mean an application has already been submitted for our agency?
It could be that
Okay.
your member, you're putting your member, what we have for your member name might not be matching what your member name is. And so sometimes in our system, if you don't put it in a certain way, your membership isn't going to pop up. And so what I'm going to do is my contact information. Do you mind, Courtney, dropping my contact information into the chat? And then you can just send that to me directly and I will take a look at your membership and go from there.
Okay, and then my second question, during your presentation, you mentioned there were 2 levels, Program of Achievement and Program of Excellence. Does this designation give us recognition for both or one or the other?
So that was in the history part, and that was whenever we used to have 2. We only have Program of Excellence now.
Okay, good to know. Thank you.
Yes, great question. And sorry that wasn't clear before. Any other questions? Was there anything else in the chat? Okay, some more questions about delegate and grantee, and we'll get that cleared up for everyone. Okay, just a couple more seconds to see if does anyone have any questions for Tony?
I just have a reflection. I encountered the same issue as the other person when I tried to register and I got to a certain point. It was saying there were 26 tickets remaining, but it was asking for the $3,500 at that point as well.
Yeah. Thank you for that, Kelvin.
I also have a question about the registration. When we registered for this session, I remember filling registration form out, and it said that I've been added to the wait list. So is that the registration for the January 6th thing, or is there something more I need to do to make sure we're on that list?
And so I'm going to go ahead and share my screen real quick. And I think that that might help whenever you're at, you might be, there are two different web pages, and then I see a lot of people go to the application web page. And if you go straight to the application web page, that is the registration one where you pay the $3,500. But there is also the download the indicators of excellence, and that is the waiting list. And that is obviously not clear. That we'll make sure to update. But I'm going to share my screen to show you here what we are talking about. And can you guys see my screen okay? Okay, great. And so this is the Program of Excellence webpage on the NHSA website. And here is the download the indicators of excellence information here. And Courtney, can we make a note that that is the waiting list one? And then whenever you submit that, I am notified that you are interested in the Program of Excellence. And then once you have that, there is here with the registration fee. And so we will clarify that too, and also send that out so there is clear instructions on registering and payments being made.
So just a follow-up question. So if we have downloaded the indicators of excellence, we are now on that waiting list, and now we wait to hear if, you know, what the next steps are. Is that correct?
That is correct.
Okay. Thank you.
Yes, thank you for asking these clarifying questions. I'm sure others had the same thing whenever they went on and registered. Yes, we have another hand up.
Hi, yes, I just wanted to know if you just wanted to download the indicators of excellence just to kind of assess your own readiness prior to completing the application, will I still have access to see the quality indicators?
Yes, you'll be able to access them as well.
Thank you.
Mm-hmm. Any other questions? Okay, well, I wanted to share is that the slide deck as well as a Program of Excellence flyer are going to be available after today's webinar. And then any questions that we weren't able to respond to today, it sounds like some questions around qualification of grantee and delegate, as well as just sort of clear instructions for registering as well. We'll be able to provide that as well. And so, Sonia, we will not be presenting at this topic in Dallas. However, I will be in Dallas. And if you would like to meet with me at any time, I'd love to talk to you more about Program of Excellence. So if anyone is going to be in Dallas next week for our parent and family engagement conference, I will be there Monday through Thursday. You have my contact information. And if you're not able to make it there and you just have other questions, please shoot me an email and I'll be able to respond to you then. Well, thank you all for today and for understanding our technology issues and my power going out. Lavon, we hope that your audio works next time. And thank you for being here. And thank you to Tony also for sharing her experience. Hopefully I see your applications come through, and I really look forward to working with the Program of Excellence candidates this next year. So thank you all for coming and enjoy the rest of your day.